Hi, my name's Georgia from BN Australia. I'm a physiotherapist and expert in pelvic floor physiotherapy. Today I'm going to talk to you about how you can use BN vaginal dilators to work through your episiotomy scar or your perineal scar after childbirth. So just first of all, let's orientate you to some anatomy before I talk about how you can potentially use your dilators. So this is Veronica the vulva. We've got a couple of key bits of anatomy here. So let's start up the top with the clitoris, which is more than just the bulb or the little part that you see at the top of the vulva. It extends down the side and internally as well. It's an amazing structure. So anyway, that's at the top. We've then got the labia majora on the outside and the labia minora on the inside, or the inner lips. The outside lips are the ones with the hair and the inside lips are the non-hair bearing lips. If we then separate the labia, we've got down the bottom what's called the posterior fourchette, and then we've got the opening of the vagina. We'd have 3 holes through here, so the urethra would be up the top where your wee comes out. We've got the vaginal opening or the introitus, and then we'd have the anus down through here. So when somebody's having an episiotomy, or if you had a perineal tear, then normally we're talking about this section through here, which is the perineal body. So an episiotomy might go off to the side. A perineal tear often goes straight down, and some episiotomies do as well. So normally when we're talking about massaging or doing any sort of scar tissue work, or if there's any pain with penetration postnatally, it's normally through this posterior fourchette region or the base of the vagina. So when we're using our dilators, often people are okay to start with size 3, pending that they could achieve penetration but it was uncomfortable, or if you can comfortably fit your own finger inside the vagina but it's a little bit stingy or burning, then size 3 is generally a good size to start with. So what we want to do with the dilator is make sure we've got a lot of water-based lube on and around the dilator and at the entrance of the vagina as well. You want to be cleared by your treating healthcare practitioner before you start any scar tissue work, and you want to know that sex is on the cards for you, so you're okay to start inserting things into the vagina. So the first thing we want to do, lots of lube on, we just want to get the dilator tip comfortably to the entrance of the vagina. And for some people that's quite intimidating or quite uncomfortable to start off with, so you just want to let the body have that natural reaction to the dilator before you continue. We then can insert the dilator a little bit further, staying away from that posterior fourchette or the base of the vagina initially, so you're going a little bit higher. And once you're about halfway into the vaginal canal, you can just start experimenting with what it feels like to put really gentle pressure downwards towards the posterior fourchette or the base of the vagina. Now, for some people that might feel okay. For some people that might be where they need to start and work through that for the first couple of sessions before you progress. So that's just going to gently start to stretch that scar tissue downwards. If that feels okay, then you might want to try some movement. So you might start by turning the dilator clockwise and anti-clockwise, just to see what a little bit of movement and a little bit of friction do with either that downward pressure or just without it, and just experimenting with the entrance of the vagina with that friction-based movement. Once that feels okay, and if that's tolerable, then you might do it a little bit more forcefully, so a little bit more pressure down on the posterior fourchette. And then you might progress to coming out and coming in of the vagina and putting a little bit of pressure down on the posterior fourchette as we do so, assuming the goal of this is to stretch that tissue to allow for pain-free penetration. As you gradually increase in both the width and the size, you'll need less pressure down on the posterior fourchette, as the width of the dilator will be stretching that entrance without you needing to apply that extra pressure. So just be really mindful of how much pressure you're putting through the base of the vagina there. Now, the reason why this can work is for multiple different reasons, but in a simplified form, it's to show the body that this part of the vagina or the vaginal canal is okay, it's not threatening anymore, it's healed up beautifully, and it's able to have friction, sensation, and touch to that area again. For some people, the role of doing this is to actually stretch the tissue. So some people will have a scar that's healed quite tight. So in that case, we might be physically trying to stretch the scar tissue to allow the vaginal canal to be a little bit more open, or that skin to be a little bit more stretchy to allow for penetration to occur. In any case, we want a really gradual progression in the size, the width and the length that you're using, and you want to make sure that you're not causing yourself more than a 4 out of 10 pain when you do it, with 10 being the worst pain imaginable and 0 being no pain at all. So go gentle with yourself. Like I said at the start, you want a healthcare professional that's treating you individually to clear you before you start something like scar tissue massage. And with their approval, they might guide you on how is best suited for you and your individual case, rather than just a general program. So always be guided by what your healthcare professional has guided you or told you to do. For more information, head to www.bien.com.au.